In this video, I will be recommending a hydrotherapy treatment for a patient with hypothyroidism. Let's get right into it. So the patient's name is Jennifer. She is a 66-year-old woman and she has a high level of TSH, or thyroid stimulating hormone. In fact, it's 4.5, so it's above 4, and a low value of free T4. She also has a family history of autoimmune thyroiditis, celiac disease, and type 1 diabetes. And she herself has Hashimoto's thyroiditis, contributing to her high TSH and low free T4, as well as she also has type 1 diabetes and celiac disease. And oftentimes, hypothyroidism comes together with other autoimmune conditions. She also has low serum B12 levels and hypercholesterolemia as well. Her weight is 65 kilograms, her height is 5 inches, and she has a BMI of 38. Again, my working diagnosis is primary overt hypothyroidism due to autoimmune Hashimoto's thyroiditis. Now, I'm gonna start with the patient script, as if I was talking to the patient in real life and as if Jennifer was sitting right in front of me. Hi Jennifer, it's so nice to see you. I understand that you have come to me due to some symptoms that you have been experiencing, is that correct? And these symptoms include low energy, fatigue, low mood, weight gain and difficulty losing weight, constipation, right, sluggish bowels, dry skin, reduced cognitive function, cold intolerance, as well as insomnia with difficulty falling asleep. Let me know if I got this wrong, but I believe these are some of the symptoms that you are experiencing. Is that correct? And I also understand that you have been diagnosed with primary overt hypothyroidism due to Hashimoto's, and based on your lab work, you had high levels of TSH and low levels of free T4, so you have been diagnosed with primary hypothyroidism, and your symptoms align well with the diagnosis. And I just wanted to let you know you're in the right place because I've got an excellent hydrotherapy session for you that you will greatly benefit from, and I hope to see an improvement in your symptoms as well after this therapy. And then I also understand that these conditions, autoimmune conditions, run in your family, and you also have celiac disease and type 1 diabetes. Is that correct? Alright, so now I'd like to share with you a hydrotherapy treatment that I think you will benefit from. I will actually share two treatments that I believe go very nicely together, and we can discuss further later on, but I'd like to educate you on these treatments, my rationale for recommending it, their benefits, as well as some contraindications and side effects from these interventions. Is that okay? Alright, let's proceed. The first treatment that I would like to recommend to you is water aerobics, and I would like to recommend this for approximately 30 to 45 minutes, 3 to 4 times a week. This treatment is low impact, so it's great for your joints, or it will allow you to be able to exercise for a longer period of time, and it will again provide you as a good means of exercise. It's very easy on your joint. It will help you also burn calories. It's also good for weight loss, and it will also provide you with some cardiovascular benefits. And of course, I usually actually recommend this for like the older population. I think it's very beneficial to stay fit, to remain active, to engage in physical activity of low impact, as well as to have cardiovascular benefits as well. Again, it's not a strenuous form of exercise. It's very light and easy on your joints, and also it can help you build community and foster socialization, as you can look for a class that has a group of people and you will be able to exercise together with them and make new friends. And I think that will also be of great benefit for you as well. So again, it's really easy on your joints, and it will help you build, it will help you make friends and kind of have that sense of community doing these exercises together with other people in the swimming pool. In addition, because you're performing like repetitive or a series of movements, it can also create new neural networks in the brain and help with mental stimulation and improve your cognitive function as well, because you're constantly trying to remember different movement patterns, and so it also has that benefit on your brain as well. Some of the risks, side effects, or contraindications are that if you perform the exercise for too long, it could be hard on your joints and may cause, pain, or can cause you to feel very exhausted. And then also, if you do this exercise incorrectly, it could increase the risk of injuries and maybe cause like a muscle sprain, for example. So it's very important to properly perform the exercises with the guidance of an instructor to avoid these problems. Another potential, side effect is that most pools are chlorinated, and chlorinated pools can cause your skin to become more dry. And since hypothyroidism already causes dry skin, in fact, you came here as this was one of your symptoms, chlorinated pools can aggravate that. So just be careful. And unfortunately, saline water can also cause your skin to become dry and itchy. So either chlorinated or saline water can both cause your skin to become even more dry and exacerbate that further. And then lastly, Jennifer, since you have cold intolerance as a result of hypothyroidism, if the pool is not warmed up properly, that can cause chilliness, and it may make you very, very cold. It may make you feel extremely cold due to your cold intolerance. And so just make sure that the swimming pool that you choose is warmed up before you enter. So before entry, make sure that they do warm up the water. In fact, that's another recommendation that I recommend for you because of your cold intolerance. Most like standard swimming pool temperatures may be a little bit too cold for you. So make sure that you go to a swimming pool that has been warmed up a little bit, and that's gonna help you not feel, that will prevent you from having that feeling of extreme cold and chilliness. And although this is probably sufficient for now, there is another treatment that I think you would really, really benefit from, and that's a neutral Epsom salt bath. So let me explain you how this works. This is great for relaxation. A lot of people with hypothyroidism and also hyperthyroidism as well, Jennifer, okay? So people with thyroid problems often have difficulty with sleeping and insomnia, which is one of your concerns. So by performing a relaxation practice before bed, in addition to proper sleep hygiene, is really, really beneficial, and it will help you get a good night of rest. And refreshing sleep is very important for your metabolism and also cardiovascular health. So I want you to perform this neutral bath. Again, I don't want it to be too hot or too cold, just comfortable, in order to relax. And I would like you to perform this for around 15 minutes, 3 times a week. And to this neutral bath, I would like you to add 2 cups of Epsom salt, which are like magnesium crystals, in addition to 10 drops of lavender or any other relaxing essential oil. And I can show you where to get those ingredients from. So a neutral bath, 2 cups of Epsom salt, which you can buy at Costco, or I will provide you a few locations, as well as 10 drops of lavender essential oil for relaxation. Again, a neutral bath can help you relax before bed, and it can also help you lower your cortisol before bed. Again, before bed we want our melatonin to be high, but we want our cortisol to be low. And actually cortisol can also be associated with weight gain as well. So it's very important to lower the cortisol before bed to prevent that, and also to help you relax, to foster better sleep, which is again very, very important for metabolic benefits and for cardiovascular health. In addition, this relaxing bath can also calm your mind, which is great, and the magnesium crystals can further relax your muscles, which is again very important before bed when you want to be relaxed, both physically from the magnesium salt and from the warm bath, and of course mentally as well. And of course, the lavender can provide an odor, a relaxing smell that can further wind you down for sleep. Some of the risks or side effects are mainly if you create a temperature that's very hot or very cold. If you by accident create a cold bath or on the cooler side, this may make you feel more chilly and cold since you have got the cold intolerance. And if you make the water very hot or on the hotter side, this can be a problem because it can change your circulation, which is problematic since you are diabetic, right? So we have to be careful with using water that's too hot. And also it can increase the risk of burns and fainting as well, because if the water is very, very hot, it can significantly lower your blood pressure, which is usually already on the low side of people with hypothyroidism. So you want to be careful. It can lower your blood pressure and cause you to feel dizzy, lightheaded, and even faint. So making sure that you don't create a water temperature that's really, really hot is important. And then lastly, if you sit in the warm bath for too long, it can cause you to become dehydrated, dizzy, and lightheaded. And so it's very important to maintain proper hydration throughout the day. And then Jennifer, I understand that you're not taking any supplements, but you are taking levothyroxine. And lastly, I would just like to discuss other possible interactions. Some other contraindications include that people with type 1 diabetes and hyperglycemia have a risk for wound ulcers and wounds that don't heal. And if these are exposed to the water, they can be infected, specifically from bacterial infection from the swimming pool. But I don't think that you have any wounds or ulcers, so you should be okay. Is that correct? And then lastly, over-exercising can increase your blood pressure. So if someone already has a high blood pressure, although the warm water tends to reduce blood pressure, over-exercising can increase blood pressure and can be problematic in someone that already has a high blood pressure, which is, I believe, is not the case with you. Is that correct? Just want to make sure that you're not over-exercising, which can increase your blood pressure too much if you haven't been doing so for a long time, and if you don't come prepared to the exercise session and just start exercising in the swimming pool, that can shoot up your blood pressure a lot. So I want to make sure that you're not starting from a position of high blood pressure. And then lastly, I want to make sure that you also don't have Raynaud's disease, because that can really exacerbate and cause attacks if you submerge your limbs, for example, your hands, your feet into cold water, should the water become cold. And so I want to exclude that possibility as well. Overall, Jennifer, I think you're going to really benefit from these two interventions, the warm bath and the water aerobics. The water aerobics will help you get the exercise, will help with weight loss, will help you build the community, and the warm bath will help you lower cortisol, relax, and gain a great night of sleep to help with your metabolism and cardiovascular health. It was very nice seeing you at this session, and we can book a follow-up session just to see how all that went. Take care and have a great rest of your day. Bye-bye.